The National Institute for Communicable Diseases has assured South Africans that it's prepared should the coronavirus make its way to the country. It comes as Health Minister Dr. Zweli Mkhize allayed fears of the spread of the deadly virus this morning during a press briefing. Newsroom Africa's Belani Pachadi spoke to the Institute on its preventative measures.
Dr. Zweli Mkhize, just literally going into detail on what the government has been doing over the past 14 to 20 days, basically, saying that there has been numerous attempts to ensure that there is adequate detection should there be a virus that it is scanned and detected, and at the same time that there are immeasurable scrutiny at the airports, as port of entries of the country, particularly the busiest one in Africa, that is the OR Tambo International Airport, where they say that there is a way that they are able to detect if there's any virus, particularly the coronavirus coming through from China, and adding that there is a lot of scrutiny on aircraft from China particularly, and Asia as a whole. The government kind of takes a look at what exactly are any kind of issues that may arise from the aircraft, particularly the issues around health deficiencies. If there's anyone who is ill and if anyone perhaps is reporting any signs of a high temperature. But with me is Professor Cheryl Cohen. She was also besides the minister, and as well detailing what this virus is, and as well as to how do you perhaps find or perhaps even detect this particular virus. Cheryl, you also mentioned that one of the things that you do in your organization is that you try to ensure that everybody that you screen is healthy, but there's something that you're looking for in case they're from China or other parts of the country, of the world, which might be infected by this.
So I think the most important aspect of being prepared for a virus like this is really having in place what we call active surveillance to detect any cases should a case arrive in South Africa. And you've already mentioned in your report one of the very important components of this, which is having people at the ports of entry who are monitoring for patients coming in with fever, and also actually going onto planes as well to look for any ill person. So the first part is really to have the screening at the ports of entry, and that people know what to do should they have a suspected case. There is another component though, because people could come through the ports of entry and not really be showing the signs and symptoms of the illness, and then become ill a day or two later. And so in order to cater for this, what we've done is we've really spread very, very widely to healthcare workers at all levels, from pharmacists up to doctors, information so that they should know what are the signs and symptoms to be worried about for this virus, and importantly, what are the other features about the patient, in particular looking at have they traveled to an area where this virus is widely circulating, so that doctors can really use this information to pick up any possible cases, and then they can really contact us and discuss whether there is a need to be concerned, and if there is a need, we are offering very rapid testing to rule out any case, and while we're testing, we're making sure that those patients are isolated to prevent onward spread, and that they're being managed appropriately to make sure that they recover from their illness.
Definitely, Cheryl Cohen, thank you very much for that particular kind of an elaboration. And also to mention is that South Africa has been roped in to detect as far as other countries are concerned, meaning that they are assisting other countries, including Zambia and Ethiopia. Some of them will be some of the inceptions that they would have taken, and other parts of which perhaps those countries want scrutinized. They would then forward them to South Africa. That's according to the World Health Organization, saying that South Africa would be playing a role as far as detection, as far as the whole continent is concerned, and some kind of supplements would be then sent and aligned here in South Africa, tested to see if there's any kind of a coronavirus in Africa. So that is what South Africa, the kind of role that they will also be playing here in South Africa.